Welcome to the office. Miss Dinora! Hi.
Hi.
How are you?
Good.
So you're coming from, where are you coming from?
Cabo. I'm coming from Cabo, actually.
And you're visiting LA and you got a few things going on.
Yes, I do have a few things going on. I have my back is bothering me, my hip is bothering me, my neck is bothering me.
And you've been having this for a while.
Yes, and I've gone to several other chiropractors, but
Anyway.
I still have, it's hanging on, it's there.
So who told you to come?
Actually, my husband saw you on YouTube.
Okay.
I saw another chiropractor in Australia.
Oh yeah, okay.
And then I told Troy.
Ian is amazing, yeah?
Yes, and I told Troy, so then he says, no, we're going to find someone closer. And he found you.
Okay. I mean, if you want a trip to Australia, Ian is fantastic. Okay. So
This is closer.
It's all good. Hopefully, let's see what we got going on here. We found a few things in the body, right? And we did go over your x-rays already. I will briefly go over them. But what we're finding is an upper cervical issue. So we're getting pressure in the upper cervical. C1, left side. T5, T6 area, left side. And all of this starting in the foundation. And I do want to discuss something in your case because there is something unique about your case. And if you don't mind, I'm going to go over the x-ray, okay?
Okay.
So what's interesting in your case here when we're looking at your x-rays is this. We know we have the neck stuff going on, and if we look at the overall appearance, the thing that popped out is what happened between L4 and L5. And if we look closer, it looks like a spondy. And what is a spondylo? A spondylo, when there's a pars fracture, pars are interarticularis, which is this part, it fractures from a trauma, whether it was a skiing or any of your fun recreational activities. And the vertebrae goes anterior to both the vertebrae above and below. And if we look here at this one, we can see 5 lines up decent with the sacrum. But look at 4. 4 has gone forward. And I can see an old pars fracture here that has healed up. Okay? The question is, how are we going to fix that? We got to bring this underneath. And typically when there's an L5 spondy, it's typically an L5 is typical. L4s happen as well. When it's an L5, in the Gonstead work, we go down to S2 and we have to torque that sacrum underneath 5 for that pars to heal up a little bit better. In your case, what's interesting is I see the space here, the spinous of 5. The spinous of 4 is tilted. But if I push that forward, it's going to make it more anterior, so that's not the answer. The answer is we got to take 5 and sacrum and bring the whole thing underneath L4. Now when I look here on this x-ray, we can see there's a bit of calcification around the vertebrae here. We don't see it here. You see that? Mm-hmm. It's just, excuse my language, it looks a little dirty, the joint.
Okay.
Okay? For lack of a better term. There's a lot of debris and adhesions and scar tissue. And that was the body stabilizing. So it did you good by doing that. But because of that, you've been compensating. Okay. And that's where all your other stuff has started to come from. The good news is your overall discs are fantastic in your low back. Overall, they're all great. L4 should be thicker than L5. And in your case, L4 is thinner. And the reason why is it's wearing out a little uneven compared to the other ones, okay? Now, as we go up, we can see the issue here in the neck. 2, 3, 4, 5, C6. And C6 is some sort of old whiplash. You can see some spondylosis or some arthritic changes in the back. Again, all of this is an old injury where the body then compensated. And if we go into flexion and extension, we can see there's not a lot of movement in her neck. Extension, there's not a lot of movement. Flexion, there's not a lot of movement. So we need to get some more movement in that neck. And what we talked about is the movement is going to start here. We know there's a T4 side slip. I am finding T6 today, so that's where we're going to start, right? It's not me just adjusting an x-ray. That's what I find. So we have the T6 we're going to work on. We have the upper cervical that we need to work on, okay? Now if we look at the upper cervical, we're actually going to work on C2 on the left. So we have C2, and we can see C2 tilted. C2 we're going to set as a PRI. T4, 5, 6 we're going to set as a PRS. And the spondy, let's look at the numbers. We're going to set it, we have the right rotated sacrum with the rotated pelvis. We have a measured difference of 3. If we adjust the pelvis, it becomes 5, so that's not the answer. The answer is we're going to be working on the tailbone, and we're going to use that right side of the... Now here's the thing. There's a 1 millimeter difference on the left side of the sacrum. It's very minute, but here's the point. If I torque, I have to torque down. So if I torque down on the center, I may bring that left side down a little bit. So I'm going to be on the right side torquing down to bring that whole sacrum underneath. It sounds all fancy what I'm saying, and people are like, yeah, whatever. You'll feel what I'm talking about, okay?
Yes.
All right. So we're going to work on C2, T6, and that S2 today. After that, we'll watch you walk again, and we'll recheck, and then we'll see what else we need to work on. Fair enough?
Fair.
You ready?
I'm ready.
Aquí. Boca abajo. So, I'm going to be slightly on that right side, and I need to torque it down. Let's slide it up a little bit more. Hola.
Hola.
Hi. How you doing? And that's the home run. Nice. Okay? That was deep, lady. So it's kind of like what I said it was going to happen, right?
See.
Relax the shoulders. Perfect. That's the home run, lady. Take your time, hold my hand, please. Just taking a deep breath first. That was deep. Walk it out. Check it out. Keep walking. As you're walking, a little different, huh?
Yes. That is different.
Come over here, let me touch the back of your hand, please. So you can watch the walk. She's holding it in so good. Walk it out. A little more movement in your dimples. Splendid. Keep walking. What's different?
I feel different. I just hear my knees cracking. That's.
Don't worry about the knees.
But yeah, I feel better. I mean, I feel like
It's
I'm.
weird, right?
Yes.
Something's weird. Something's different, but you're not.
Yeah.
It's okay. Come over here. Let's have a seat. Sit back from this. That was deep. Relax the chin down. Good. You gotta give it to me though. You're fighting. Chin back. Hands on your lap. Hands on your lap. You're fighting.
Yeah, sorry, I can't relax.
Fight. No. Come over here. Pushing and fighting now. Face down. Who are you fighting is the question. It ain't me. Slide up. Poquito más. Bueno. There you go.
Oh.
There's a piece. Let's come back over here and let's do a little alternate move. You feisty. Have a seat. That's all right. All the way back. Good. Wow. That's it. Let's go back down. I gotta do something different. Go back down. Right here in the hole. Right here in the hole. Turn your head to me. There you go. Left hand up. That's your right. Left hand up. Home run. Gotcha. That was it.
Yeah, that's good.
That was a sneak attack. That was a sneak attack. She's smiling. She's laughing. Step away from the vehicle, man. I said, walk it out. Walk it out.
I heard it like almost like a metal zing in there.
It just went clunk,
Yeah.
clunk, clunk. Walk it out.
That was good.
Walk it out. Move your shoulders back. That should be different now. A little different?
It's a little different, yeah.
Okay. Let's continue. Have a seat. All right, let's run the meter on the back. Deep breathing. And out. Starting at the base. Neck is clear. T6 is clear. Gonna get some heat, but we're gonna be okay. Sacrum is clear. Check it out. Back towards me. Back, back, back. Don't be scared. Look, that's 5. That's the 4, remember?
Mm-hmm.
There's less gap here too. 5. Check it out. 1.
Oh, that one hurt it.
Number 2. That's the one I adjusted.
Okay.
All right, let's continue. You ready?
Yep.
Ears. Shoulder. Don't help me. Boca arriba. In your back. Ankle. Ankle. Sit up and turn, please. Walk it off again, please. Why are you laughing?
I feel like an old person.
What?
I feel like an old person, I said. I shouldn't feel old.
No. The key right now is going to be your movement, okay? And making sure you get lots of movement.
Okay.
All right, we got things freed up for you. Have a seat over here, please. Let's run the meter and make sure nothing went out up top. And then I need to work on your jaw. Good. Let's continue. Sit back for me, please. Open. Ahí caramba. Open. Right deviation. Well, sir, she's definitely still holding everything inside. She's trying to let it out, but she's not ready still. She's still that, how do you say it for a female, that muchísima? She got some muchísima, right? Is that the right word I'm using? That's not the right word. You know what I mean though, right?
Yes.
I'm trying to say it in a nice way. You gotta let go, lady. You gotta let go. Just breathe. Open. Open. Close. She's not giving it. Come on, you gotta give it. Let it go. There's stuff you need to say that you're holding back on, and it's not me. And she needs to say it, like this week. It's part of why you're here. So she needs to open up and speak her piece too. Open. Close. Yeah! Ah! Was. Got it. Was. There you go. See when I do the left versus the right. Walk it out, lady. Check it out.
Get it out.
Check it out.
Small.
I don't know what the name is. I don't know what the female name is.
I don't know what it's from here.
Different?
Yes.
No, it's different.
Yeah.
Okay. All right. So if you enjoy yourself tomorrow, you get all your movement in. Okay. And I'm not worrying about the knees right now.
Mm-hmm.
I want you to do some backwards walking if you find it have an open space. 5 minutes walking backwards or pedaling backwards. So like when you're back home and back in your routine and stuff, I'll give you homework and everything at that time. Okay, madam? Come over here.
Okay.
Let's shake your hands. Squeeze.
Oh, I can't.
Squeeze. Let's shake your hand. Relax the elbow. Relax there. Squeeze now. There you
Better.
go.
Yeah.
Squeeze. Squeeze. Questions for today?
No, just put ice, right? And just do walking
You're
around.
ready to get out of here, right?
You do my jaw again.
What's that?
Before you do my jaw again.
I don't have to touch anything. It's whatever you want, okay?
It needs to be
You're
fixed.
here. You're
It
here.
needs to be fixed.
I mean, it's up to you.
Yeah.
You'll tell us the difference on Friday, what changed, okay?
Okay.
It's not about good or bad, it's what's different.
Mm-hmm. Okay.
You can tell me more or less, this, that, whatever it is, okay?
Okay.
And you try to notice the difference. Oh, hold on.
Septum?
No.
My nose is good.
It's not needed.
Oh, my
It's
nose
not-
is
it's
good.
not- It's not the septum. I have a feeling it's the upper cervical, but let's see, it could also be the jaw. Let's see, you report back to me on Friday,
For my
okay?
brain, for my.
And then we'll decide from there, okay, madam?
Okay.
Welcome to the office.